How can I fix my eyelids? They don't match. About 4 years ago, I had a severe case of pink eye. My eye was swollen for several days. Since then, it has never been the same, and I hate how it looks in photos. Is surgery the only answer, or can I do something else to get back to normal?
Thank you for your question. You've submitted a photo and you want to know about how to help make your eyes match. You describe in your question that 4 years prior that you had a very bad case of pink eye and that your eyes have not been the same since. Well, certainly I can give you some perspective on your question. I'm a board-certified cosmetic surgeon. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. I specialize in cosmetic and reconstructive surgery in the eyelid area. And I deal a lot with revision surgery for complex reconstructions as well as complications of infections and cosmetic surgery. I've been in practice for over 20 years, so I can certainly give you some perspective. When you had this pink eye episode, if we define pink eye as conjunctivitis, where your eyes are tearing and wet and always watery and eventually it gets better, it's a little bit surprising to see a change in the space around your eyes. What I see when I look at your photo is the left eye has a very high crease. And very often the high crease is a result of loss of volume, and typically a volume of orbital fat. Orbital fat is fat that's normally around the eyes. The eye socket is referred to as the orbit. Now, it does happen in patients who have had infections, such as something called cellulitis, or preseptal cellulitis, or orbital cellulitis. Certainly, these are terms that are important for you to maybe recall, because it seems unlikely that it was directly from an episode of conjunctivitis. However, you should look at your photos from beforehand and when you go seek the evaluation of a specialist such like myself, like an oculoplastic surgeon. Now, when it comes to this hollow area, there are options that are both surgical and non-surgical, and both non-surgical and surgical options have their pluses and minuses. Prior to the use of fillers, my approach in this area for patients who are typically had high creases as a result of cosmetic surgery, I would do fat grafting. I would essentially harvest fat from an area of the body and place the fat into the space in different levels to try to get this fat to heal and for the body to take it. When you're doing is you're taking cells or tissue out of one area, taking them away from the blood supply, putting them in another area, and then hoping the blood supply will take. Now, when you hear this, it should make you concerned that what if it doesn't take? And that's one of the challenges, is that grafting very often requires multiple procedures. Now, there's other methods such as dermis fat grafting. This is a little bit of a different approach that involves an incision on the eyelid and the placement of a combination of skin and fat placed into that space. Again, it is a surgery, and again, it is a graft. Therefore, there's some unpredictability. Now, in some patients who have had this hollow appearance, we've actually used fillers such as Restylane and Juvederm in a conservative way to try to bring down this sub-brow area to try to fill part of that orbital space. It's generally not advised in that high area to put the material inside the orbit. It just doesn't seem to follow any type of predictable behavior, but sometimes we can actually get a nice cosmetic result with just the filler alone. We've also combined the filler with platelet-rich plasma, trying to get a synergistic effect, as well as try to get some tissue growth from the benefit of the PRP, or platelet-rich plasma. I think it's important that you meet with doctors and get some opinions. I would recommend oculoplastic or oculofacial plastic surgeons. This is a very specialized area, and it's, in my opinion, from my experience, again, my bias, that you would be best served by someone who does this as a significant part of what they do in their practice, and get some opinions about what would be best for you. And you should also see what's your tolerance, what can you handle in terms of predictability. It's very important that you communicate and go in, work with the doctor you're comfortable with in terms of the risks and benefits. There's obviously no perfect solution for this. So I hope that was helpful. I wish you the best of luck, and thank you for your question.